This is Soapbox Radio. Potting it out there with my lime boots. The Wellbeing Edit.
Hey guys, it's Ryan. It's a Thursday afternoon. It is 4 o'clock, just gone 4 o'clock here in Joburg. Time for Soapbox Radio. We are doing a Wellbeing Edit show today. As you guys know, Wellbeing Edit shows, we look at matters to deal with grooming, skincare, and we have a leader in the industry with us today. We're also doing another outside broadcast. So I find myself today in Parkhurst at one of the clinics. Today I'm chatting to a legend in the local skincare and aesthetic medicine industry who founded a group of clinics that has now spanned 16 branches across South Africa. Skin Renewal. Skin Renewal also provide me with all my skincare needs, and we've been partners for about a year and a half now. So it's a very special afternoon for me to spend some time with founder Dr. Maureen Allem. Welcome, Maureen.
Hi, Ryan. Thank you.
Thank you for joining me. Let me give you some background to Dr. Maureen and Skin Renewal. Dr. Maureen started the Specialist Aesthetics Centre after several years of providing injectable aesthetic treatments to her patients. Dr. Maureen realized the need for a fully fledged aesthetic center as a result of the advances in aesthetic technologies, which provided alternatives to the more traditional surgical procedures that had been practiced to that point. The development of new laser, light, radio frequency, and ultrasound technologies provided a cost-effective means to improve the quality of skin and also treat a wide range of skin and body conditions. The first Skin Renewal opened in Rivonia in 2005, and was followed by Parkhurst, where we find ourselves today, in July 2006, Fourways in October 2006, Hyde Park in January 2007, and Rivonia Village in April 2008. The group continued to grow and is now represented by 16 branches across South Africa. Dr. Maureen herself is a general practitioner with a special interest in aesthetics, and integrative anti-aging medicine and procedures, who frequently travels all around the world attending world anti-aging congresses and laser forums to stay abreast of the most up-to-date non-surgical procedures. She is also a sought-after speaker on anti-aging and non-surgical facial rejuvenation techniques and body sculpting. Dr. Maureen, that's a mouthful, and I think I only skimmed half of it. Have I summed you up correctly, Dr. Maureen?
No, absolutely. So skin and health are my passions.
Health and passions,
Skin and health, yeah.
Okay, so Dr. Maureen, tell us, where does your passion for medicine then stem from?
You know, my father was a dentist, and he always wanted to be a doctor, but he had 9 children, so it was very difficult to go back and study.
Yeah.
So he didn't push me, but I've always, been in that medical field.
Okay.
And I decided at the end of Standard 9, which we grade 11, that actually quite impulsively, because my father always said to me, Maureen, he always encouraged his daughters and sons to study. And he always pushed me towards pharmacy. And so I thought, okay, I'm going to be a pharmacist. And then one day my elder brother came back home from the army, and he said, what are you going to do? And I said, I think I want to do pharmacy. And he was desperately trying to get into medicine. And he said, no, man, don't do pharmacy. Come and do medicine with me. No, he was doing medicine. He was going to get into medicine, and I must do medicine. I said, oh, that's a good idea.
Okay. So
let's do medicine. So,
okay.
But it always was in the medical field.
Okay. And then the penchant for aesthetics?
That started about 1999. Do you remember when the F.W. de Klerk, the president's wife, Marika, she had that terrible frown?
Yes.
And then there was a whole talk about how she always looked so surly, and she wasn't a surly person. It's just that she had a bad frown.
Yeah.
And they started talking about this Botox. And eventually in about 2000, myself and 3 or 4 of my sisters, we went off to a plastic surgeon. He was there were only 2 plastic surgeons in Johannesburg doing this Botox.
Okay.
And we went off to him, and I sat with him while they were having their Botox, and I had my Botox. And I thought, I could do this. I mean, this doesn't seem so crazy. And then about 2 months later, because then I went straight to my MIMS to see where this Botox was, because MIMS is where all the prescription medicines are. And I couldn't find Botox in the MIMS. And then about 2 months later, I received a dermatology review. And in the dermatology review, there was this full-page ad on Botox, and where it was coming from the company that was distributing the Botox at the time. So I called them up, and then they sent their trainer to me, and we did it at my sister's home, and all my sisters were lined up, and a few friends.
So you had a perfectly Botox
family. And I actually
family.
saw one of the original friends that I did 17 years ago.
Yeah.
I saw in Cape Town last week, and I said, wow, it's amazing. You're still coming.
Yeah. I think it's addictive once you
so
start.
So I tried it out on all my family, and 1 or 2 big bruises.
Yeah.
But after that, you learn very quickly.
Yeah, I suppose you must have had one of the best looking families with all their Botox floating around.
Amazing, yeah.
Wonderful. Stay tuned, guys. I'll be back shortly with Dr. Maureen. Don't forget to send any questions and comments you may have via my Facebook and Twitter accounts now, and be part of the show.
You're tuned in to Soapbox Radio. Podding it out there with My Line Boots.
Find My Line Boots on Twitter, Instagram, and Facebook.
At My Line Boots. And on YouTube.
At My Line Boots Live.
Great, if you've just joined us, I'm chatting to Dr. Maureen of the Renewal Institute, which includes Skin Renewal, doing a live broadcast from Parkhurst this afternoon. Dr. Maureen, you recently returned from a trip to Monaco for the 15th Aesthetic and Anti-Aging Medicine World Congress. Is this an annual entry in your professional calendar?
You know, it is. I first went in 2005. I think that was the first or second congress that they had, and it's held every year in Monaco at this time, just over Easter. And the first time I went, which was amazing, there must have been 4,000 people there. Yeah. Dermatologists, plastic surgeons, aesthetic practitioners like myself. And I got so lost in these huge halls. And to this day, I actually still get lost. It's amazing. There's you can't believe. But now, this year, there must have been 10,000, 12,000 people.
Oh, goodness. So from all around the world.
From all around the world. Mostly Europe and, Russia, Eastern countries.
Okay. Do you find a lot of other South Africans attending?
Yes, quite a few South Africans, because now the major distributors do take over. Every year they do a different group of people, so they do bring the South Africans over there.
Okay. How long have you been going, Dr. Maureen?
Since 2005, but I missed a few years. I used to send the other doctors in our group, because every year we decided, we'll send another, one of our doctors to experience it.
Yes.
And then I realized that I need to go myself, to pick up all the new trends. So, I haven't been every year, but I go like every second, third year.
Okay.
So I've been quite a few times. But now lately I'm going every year.
Every year. I'm sure there's such regular advancements that you almost need to be going every year.
Yes, you always learn something.
I'm sure.
You never can know. You can never know everything.
100%. From your perspective, Dr. Maureen, what are the draw cards that see you return each year?
Just, different techniques on how to inject and different areas to inject. But you've got to be so careful, because there are so many halls that you can attend. So this year we took 5 doctors from our company,
sure.
4 doctors and one of our head trainers. And so the head trainer and I sat and decided who was going to go where, so that we could cover the whole Congress. Otherwise you miss out on a lot.
Sure.
So we learned a lot of, even last night one of the doctors was presenting on what he learned during his trip there.
Yes.
And we did a whole thing on nose rejuvenation. We do a broom thread where we can non-surgically correct your nose by doing threads, a thread that contains 10 threads. It's called the broom thread with filler. So you can reshape and make your nose more aquiline.
Okay.
And then, like last night, he was teaching about this Eiffel Tower method, where you actually go into the bottom of the nose and you inject like a tower of filler, which actually lifts the nose up. So these very patrician noses that dip,
yes.
you can actually give filler in the base of the nose leading up, to actually lift the nose. So quite amazingly, and it takes like a few minutes to do, and with huge results. Yeah,
amazing the techniques that are coming out there. What is the history of the conference, Dr. Maureen?
It started. They actually just phoned me today to ask me, what did I think of the Congress? I was, having a massage. I had a bit of a fall this morning, so I've been quite stressed all day. And this woman phoned me from overseas, and I said to her, it's so nice that you've actually got hostesses helping you, find the places. Because very often they had these French men in their suits, and no one could help you.
Yeah.
And you see these desperate faces of doctors trying to get to the different halls, and they can't find the place. Anyway, so what was the question?
So it's asking what happens at the conference, sorry.
Okay, so you get like these huge halls which seat 5,000 people. Okay. And then they have demonstrations. They have like initial talk, like an introductory talk. And what's nice about it is, they're not pushing a filler, a certain brand of filler. It's generalized fillers.
Yeah.
And then so they'll do like a general introduction, and then they'll have someone injecting behind, but projecting on a huge screen. So you can all watch how he does the nose and how he does the temples, or he does the chin.
Yeah.
And another great thing that I learned at this Congress was how to masculinize a male with a feminine, more like a baby face.
Yes. Okay.
So like, and like certain tips that the size of a man's jaw is the same width as his mouth, and the size of a woman's jaw is the same width as her nose. So those, those tips and about giving a lot of filler on the jawline for a man to actually masculinize the jaw. And a man shouldn't really have big cheeks, he has flat cheeks. But they also lose volume, but then you don't over-voluminize those cheeks.
Yeah. Okay, so some interesting things coming. Are all of these coming to South Africa,
Yes,
to Skin Renewal?
absolutely. You'll see it in the newsletter. Just,
Wonderful. Can I make a
just-
booking this afternoon?
Sure. Just keep getting our, sign up to the newsletters and you'll get
Definitely.
all these new
All these
treatments
advancements coming
and
through.
advancements.
Okay. When we come back, I'll be talk to Dr. Maureen about trends from this year's conference. Stay tuned.
This is Soapbox Radio.
Potting it out there.
Potting it out there with My Lime Boots. The Wellbeing Edit. Share your thoughts and be part of the show now.
Send a message on Twitter or Facebook.
At My Lime Boots.
Find My Lime Boots on Twitter, Instagram, and Facebook.
At My Lime Boots. And on YouTube.
At My Lime Boots Live.
Great. I'm back with Dr. Maureen, founder of the Renewal Institute. Dr. Maureen, were there any specific trends that stood out for you at this year's aesthetic and anti-aging medicine World Congress?
Okay, so I spoke about the masculinization
Sure.
of a male face, and then also a big thing was PRP, which is platelet-rich plasma. So that's like, the very sensational vampire
Is that the
face.
vampire face?
Yes.
Oh, okay.
And so you draw your blood and then you spin it down and then you discard the red blood cells, but you keep the plasma because that's where all the growth factors are that cause wound healing, that help with wound healing.
Sure.
So obviously it helps regenerate the face. But what was very interesting that they're using it in very different areas. You can do it for the hair. It's amazing.
Oh, really? Okay.
But you have to start early. You have to start when you start. You have to start the treatments when you start seeing the hair start thinning and miniaturizing. It's pointless to come when the hair's gone.
Yeah,
So
yeah. Can't bring it back.
But even in a male, it takes a few years for you to actually lose the hair. So
Sure.
don't leave it when it's till it's too late, because you can improve that hair growth and re-stimulate that follicle.
Sure. I think most guys just don't want to admit that they're actually losing their hair, so that's a bit
I know
difficult.
there's so many treatments that you can do for hair loss.
Yes,
huh?
you guys are busy helping me at the moment with that.
Okay.
So yes.
Yeah, so you do PRP for hair loss.
Yes.
You do they call the O shot and the P shot,
Yes.
which is used for male and feminine sexual rejuvenation.
Okay.
And that was very interesting. And then obviously for skin rejuvenation, which we are doing now at the moment, we're slowly introducing the hair renewal, the PRP for the hair.
Yes.
And then down the road, maybe we'll think about, it's not really our field of practice, but
Sure. Okay. Because you guys, as the Renewal Institute, offer more than just skin renewal. You've
Yes.
got. You want to maybe take us through that?
Okay, so Skin Renewal is all the non-surgical anti-aging and thing for skin. Then we do the Body Renewal, which is our weight loss program.
Yes.
We have an amazing weight loss program. One of our doctors, he's just lost 16 kilos.
My word.
Even his mother was like, couldn't believe it. He looks amazing, and he's done our Body Renewal diet, a weight loss program. Then we have a lot of cellulite, ladies with cellulite, who come in for cellulite treatments and resistant fat. When you
Just can't
exercise a
lose.
lot and
Yeah.
you can't lose it, because very often, I've done all those genetic testings.
Yeah.
You have to have a certain gene that actually activates fat. And unfortunately, like with my DNA diet test that I do, I don't actually burn up fat in exercise. So I've got to do
Yeah.
high mets, like 30
Yeah.
mets,
Yeah.
to actually get rid of fat.
Yeah.
So those resistant pockets of fat, we can inject them. We can do a few ways. We can do our cryolipo fat freezing, which is also quite big. It's also there at the Congress. Or you can inject it with phosphatidylcholine, which is an amazing anti-aging product because it's lecithin, it's soy lecithin. Or you can inject it with a new solution, which is a mixture of vitamin C and iron. And that, when you put those two oxidants together, become those two antioxidants become pro-oxidant when you mix them together.
And burn the fat.
And they also burn the fat cell down without any swelling, which is amazing.
Yeah.
That was done by a professor of regenerative medicine in Italy, Prof. Ceccarelli. So we call it our
Yes, the
Ceccarelli
Ceccarelli.
solution.
Yes, yes.
It's amazing with no swelling.
Yes, 100%. Dr. Maureen, you're exposed to so many new things. How do you decide from the Congress what you're going to implement back here at Skin Renewal? Obviously, you can't implement everything you see.
No, you can't.
Yeah.
No, but a lot of, to be honest, a lot of the things we really are doing the PRP. We do the Dr. PRP, so we're doing that. We do a lot of fillers. We do the Botox. Just certain techniques that you can learn from all these experts.
Just slight difference on the
yes,
application.
like
Yes,
nose and
yeah.
temples
Okay.
and jawline.
Yes. Okay.
And then we introduce. There's also the brain renewal, which does neurofeedback on the brain.
Okay.
So for people, with people with like memory loss and ADHD. And a lot of people are on antidepressants. You start building up a midline in the brain. So what the neurofeedback does is actually reprogram the brain and put all the waves in the right place. Like the beta should be at the back. Look at your alpha cognition. And I've done 20 hours of that, and it's quite amazing how you can improve your memory just by increasing, by training your brain.
Really,
So we do the brain renewal, and then we also do sleep renewal, because it took me many years to diagnose, for me to diagnose my own sleep apnea. I didn't know what was going wrong with me, and I'd been to so many doctors and neurologists, and they told me I'm stressed and I must take Prozac. In the meantime, I had sleep apnea. And that's my big passion, because people don't realize what sleep apnea is all about, and how common it is, and what it does to our body, how it stresses the body out, and how it totally starts destroying your arteries everywhere, especially your coronary arteries and your arteries in your brain.
So quite something.
So it's a big passion of mine. So we've got sleep renewal now, where patients can come and get kit up and go home and sleep in their own bed, and we can send it off to the neurophysiologist to assess it and to see whether you've got a sleep apnea or upper airways resistance syndrome problem. So that's another thing that we've introduced the last year.
Okay, great. Stay tuned. When we come back, I'll be talking to Dr. Maureen about aesthetics, specifically here in South Africa.
You're tuned in to Soapbox Radio. Podding it out there with My Line Boots. Share your thoughts and be part of the show now.
Send a message on Twitter or Facebook
at My Line Boots.
Find My Line Boots on Twitter, Instagram, and Facebook.
At My Line Boots. And on YouTube.
At My Line Boots Live.
Dr. Maureen, South Africa has always been a rather conservative market when it comes to aesthetics. Is this still the case?
No, people are slowly realizing. 10, 15 years ago, when I went to that Congress in 2005, they said people want fillers. Now, and they warned us that it's going to change. People are going to need Botox and fillers and all this anti-aging stuff. So I think that's where we reach now. People realize, they have to compete with younger staff members in the boardroom, and you don't look like a granny, so you need to, or a grandpa.
So it's like having a good haircut when you've had that feeling, just feel good about yourself. Not to say that you should get your sense of identity from your appearance, but it certainly does add
unfortunately
it does. It does give you that boost,
and it does make a difference, to
your mindset, I suppose.
To your mindset and to your success in business.
Sure,
it does.
Very much so. I think there's been many studies on
Absolutely.
that. So do you see this conservative nature changing? Do you see us graduating more to a society that's open to these things? I mean, these days, if I tell people, because I have Botox through you guys and fillers, people don't look at me as if I'm doing the wrong thing. But I mean, in the old days, I think it used to be an issue.
It's like ridiculous. But then I say, then why do you go tint your hair? Or why?
100%.
So it's just it's part of the aging. And why should you age if you can do something minor? And if you can afford it, why not?
Exactly. So we've spoken about Botox and fillers. Do you see the South African mindset changing in terms of any other aesthetic practices that you perform?
Yeah, you see, we're trying to educate our patients who come to us for a little bit of Botox, especially the older women, that it's not only about Botox. You have to, as I say, the 4 pillars of preservation of skin. Injectables form part of one pillar. Okay, so Botox, fillers, and threads. And then the second pillar would be in-office treatment. You got to start conditioning your skin. So you can do a PRP facial, you can do a laser facial, you can do a peel with a bit of meso. There's so many things that you can do to rejuvenate your skin. Because it's not only just the Botox. The Botox doesn't really fix the skin.
No,
you need to start. And we had a lecture last night about aging, and it's scary how all the things are as you age, you can't believe what happens to the skin, and never mind the body. All due to, guess what? Inflammation. And the aging process.
What's causing that inflammation?
Where do you think it's coming from?
Probably stress.
Very often it's the gut, and people don't even know it's a leaky gut. Because a leaky gut, you leak toxins, rubbish from your intestines into your system. And then the liver can't cope, and then your whole immune system gets activated. And this was taught to me by a professor of immunology. He does functional medicine. And that's the biggest passion of my life, is the functional medicine, which is getting optimal health. And and looking at optimal levels of your blood results, not just looking at the extremes.
Fixing this one, fixing that one. Hey?
Yeah.
Your clientele here at Skin Renewal and through the Renewal Institute, is it obviously split between male, female, larger bias towards female, or do you see more men starting to come
No, the
through
men
for
are
these treatments?
slowly starting to catch on.
Yeah.
I mean, what's so amazing, you go to a 40-year reunion. Okay, so my sister went to one the other day, and she showed me the pictures, and I said, oh my goodness, the women look 40 and the men look 70.
Okay.
And all the women, those of the women are doing something, and the men
Yeah.
are just carrying on with their
Yeah,
life.
it's normal, yeah.
And that's when you see the difference. When you
Yeah.
go to your 40-year reunion, and
Yeah.
you can see that the men look their age and the women look 10 years younger.
Should have had some cards there. She should have handed out some cards for you, given special discount. Okay, stay tuned. If you've been waiting for a few gems of insight from Dr. Maureen, like I have, be sure to stay tuned. We'll be back shortly.
This is Soapbox Radio.
Potting it out there.
Potting it out there with My Lime Boots. The Wellbeing Edit.
Find My Lime Boots on Twitter, Instagram, and Facebook.
At My Lime Boots. And on YouTube.
At My Lime Boots Live.
I'm live this afternoon with Dr. Maureen, founder of Skin Renewal. Dr. Maureen, let's get down to some brass tacks, as it were, when it comes to aesthetics. Over your years of being an aesthetic doctor, what would be the treatment that you cannot do without? The treatment with the best results in your book?
We've got lots of good lasers, and I can't do without my skin tightening lasers. So
Okay.
either tighten laser, because at this age now everything starts sagging, and the whole of your, not your lateral part of your face, but your mid face, your jowl
your
area
jowls.
starts sagging
Yeah,
down.
okay.
So I love my Titan to tighten my skin, and then our new monopolar radio frequency treatments. And then, I know I'm always going on about our miracle laser, the Laser Genesis, which is colorblind. So you can do all skin types. But what it does, it does rejuvenation, so it does fine lines, wrinkles, pores, and texture. But better still, it takes the inflammation out the skin, because it's the inflammation in the skin coming from the leaky gut
Yeah.
and other places. So the inflammation in the skin that stimulates the sebaceous glands to make acne, that stimulates the melanocytes to make melanin, that stimulates, it gives people rosacea and acne. So it's that inflammation. So it takes that damage out the skin.
Okay.
And then also, the bonus being that it's also rejuvenative. So
Yeah.
most of my patients get laser genesis, because we see a lot of patients with pigmentation problems.
Okay, all right. Okay. And finally, Dr. Maureen, as an aesthetic doctor, what would be your 3 top tips for people to look after their skins in the best manner?
Okay, number 1, start wearing sunblock, and we've got some amazing sunblocks that not only deal with UVA, UVB, but also infrared A, high energy visible light, heat, because people don't understand that heat also can stimulate the skin.
It's unbelievable.
And then we've got
yeah.
a new amazing sunblock that actually starts treating the damage in the skin from like skin cancers.
Okay.
So you often get a man with like, he thinks it's dry skin, he's bald on the top, and he says, look at my skin, it's dry, I need to fix it. I said, no, it's not dry, it's just got all the sun damage.
Yeah, yeah.
So if you start using that sunblock, the special sunblock, you can actually start reversing that skin damage in the skin.
Okay.
Yeah, so very important to do
Okay.
it's,
Preventative.
yes, SPF.
Okay.
And you mean general products
Yeah,
to use?
just what are your 3 top tips?
Before I used to say stay out of the sun, but the sun is actually very good, because we all need vitamin D3, and we are so short of vitamin D3. So a little bit of sunlight, but don't burn your, what I call your face, neck, and décolleté, because that is
Yeah.
your face.
Yeah.
So put sunblock on that, but the rest of the body can get a bit of sun.
Sun,
But
yeah.
obviously not in this, in the bad hours of the day.
Yeah.
And just for 15, 20 minutes. So just being in the sun for 15, 20 minutes gives you like 20,000 international units of vitamin D3,
Sure. Okay.
which you need, because that's part of your immune system as well, vitamin D3.
Okay.
So obviously not to overdo it and not go fry yourself to a
Tea at 12 o'clock.
no, absolutely no,
Yeah.
that's crazy. But just
Yeah.
a little bit of sun each day is great. And then the third thing I'd say, watch what you eat, and cut the sugar out,
Yeah,
and
sugar's
all
a
the
baddie,
diet,
huh?
all the diet stuff, because that's just crazy.
Yeah.
Because sugar, once again causes inflammation, and causes the cross-linking and gumming up of all your protein, which is your collagen and elastin. So,
Okay.
and so those are the basic things for skin.
Yeah, 100%.
Okay.
Dr. Maureen.
And aging.
And aging, for sure. It's been an absolute honor to spend time with you this afternoon. It feels like we've been speaking for 5 minutes. I really enjoyed talking to you about aesthetics. And thank you very much for all the skincare needs of mine that you take care of as Skin Renewal. A huge thank you to you for that. Thank you
working with you. Thanks,
Thank you so much. I look forward to more international cutting-edge treatments right here in South Africa at Skin Renewal. If you check out my blog, Facebook page or Twitter account, you'll see that I've just posted contact details for Skin Renewal. Well worth making an appointment to see one of Dr. Maureen's doctors for an assessment and an action plan, just like I've done. Next week, I'll be coming to you live.
You've been listening to Soapbox Radio.
Podding it out there with My Lime Boots. Find My Lime Boots on Twitter, Instagram, and Facebook.
At My Lime Boots. And on YouTube.
At My Lime Boots Live.